Okay, so basically, the way I've decided to structure this session today is first we'll talk about AMC clinic, like the format, the marking scheme, what they're looking for, and then at the end we'll do two mock sessions for Sumuk and for Minchu. Is that okay?
Yes.
Right. So basically, the level of the exam AMC2 is directed towards someone like an Australian graduate who has just finished their final year exams and they're entering their internship. So that's the sort of level that they will be testing at, and which you guys are actually supposed to be like you're supposed to. I don't know about Minchu, sorry, but Sumuk, you are technically supposed to be above that. Okay.
Okay.
Um, so you've got 20 stations in total, which includes 16 clinical stations and 4 rest stations. 16 clinical stations are broken down into 14 scored stations and 2 pilot stations. So pilot stations are things that they are trying out, new stations that they're probably introducing, but they haven't had enough data to kind of like um, actually put that as a scored stations. But sometimes the reason why I've put that asterisk there is because sometimes in a scored station, if they have any difficulty, like for example, there is some error that happens, like they've lost the score or whatever, sometimes there is a chance that they might use the pilot stations as a score station. So you have to kind of like take all the clinical stations seriously. And you need 9 out of 14 stations. You need to pass 9 out of 14 stations to basically pass the exam. And throughout this, the total duration for each station would be 10 minutes. And you will be given 2 minutes of reading time and 8 minutes for the station. And just to let you guys know, if you've got any questions in between, feel free to ask. Okay. All right. So there are a few things that are generally tested in the clinical stations. Like for example, you've got history taking, examinations, diagnostic formulation, like the way you think about the case from all that information that you've gathered, the way you think about it, and then also talking to the patient. Like for example, it could be telling about management, counseling, giving education to the patient. Usually, what I've noticed is we're like as students, MBBS students from India, we're actually really good at history taking sometimes and examination as well. But we are kind of and diagnostic formulation, although we don't actually verbalize it. This is something we need to learn. Um, but management and counseling is actually something that we kind of like are not that good at, and we need to kind of like improve in that usually. Now, some of the examples that we can have in management or counseling stations would be things like counseling someone who's obese to lose weight, presenting a management plan, like, this is how things are, this is what you're supposed to do, all that stuff, and explain to the patient how to use an inhaler. So, all of this stuff would be counted as management, counseling, or education. Are you clear with this? Four domains that are usually tested.
Yes, sir.
Okay. Now, what subjects are tested? This is basically an exam that is at the level of a GP sort of thing. So most of the subjects that we study in final year, that's what is usually tested. Like for example, medicine, surgery, women's health, pediatrics, mental health. So these are the broad subjects that are tested, and this is actually once you actually qualify and if you enter training as a GP, these are the things that you will be seeing in your day-to-day scenario. Okay, so things are like anything that's important from a primary care perspective is important here. And some of the other things to be aware of, like it depends where you are as well. Like for example, you will have a scenario which will tell you whether you're in a GP setting or in a hospital setting. That's quite important because the way you manage a case changes based on that. For example, if you're in a GP setting, you will not have access to any of the investigations. You will not have access to like quick referrals and all that stuff. Whereas if you're in a hospital, you will have access to investigations. You can like like you could get advice from your seniors, the consultant, and all that stuff. But in a GP, that's difficult. So you have to be aware of where you are in that clinical scenario that you have been given. So it's important to also know what facilities are there in a GP or in a hospital. That's also important. And then comes urban versus rural. Like you, obviously, it's gonna be challenging to manage patients who are rural because you won't have any other support. So it's very important to do a few things, like for example, safety netting would be quite important. We'll discuss about that in a later session. And whereas if you're in an urban situation, you've got more access to secondary care, tertiary care that you can refer on to. Okay, so that's another difference to be aware of. And then the other thing is that your role matters as well. Like for example, some of the situations you are a FY2 in a GP surgery. Some of the situations you are a registrar in a GP. So it depends on what your level is. Because you most of the time this is at a level of a fresh graduate, it's quite important for you to be aware that you're not expected to manage everything. Some of the conditions you are expected to recognize and actually get help from your senior. If you actually end up try and manage those situations yourself, you will actually be marked down on points. The reason being, they don't expect you to be able to handle everything, but there are certain conditions that you are actually will be expected to handle, which you should handle appropriately. I'll give an example just to illustrate my point. For example, if you've got someone who is septic and you've done what you're supposed to do, which is like IV fluids, antibiotics, all that stuff, and the blood pressure has still not picked up despite giving IV fluids. At this point, they don't expect you to manage the situation. They expect you to escalate it. So it's important that you are aware of your of your own role and are able to recognize when you're supposed to escalate things. Okay. Okay. Now this is how a typical scenario would go like. They'll give you a clinical stem, they'll describe a situation like this patient in that situation was going this, and then they'll give you tasks. Like for example, they could tell you to and this is like usually it'll be three to four tasks that they'll give you. The task will be either like take history from the patient, get some examination done, and manage the situation. So that is three tasks. Or it could be you've been given this information about the patient already, you have the information, but you are expected to counsel the patient about a particular thing. Like for example, it could be how to take an inhaler, you have to counsel them. So those are the tasks that you have to kind of like achieve. And during those tasks you will be judged based on one of the four domains that we mentioned earlier. So these are the four domains. So a task is something that will be testing you on one of these four domains. Okay, and then usually they will also give a suggested timing for the main task. So out of those four or three tasks that you have been given in the STEM, you will have one main task that you'll have to kind of like achieve in a certain time limit. Like an example, they could give you like a case history, like you're supposed to take history, that's one of the tasks, but you'll have to finish it within 5 minutes. Remember, I told you you will have 2 minutes of reading time and 8 minutes to actually do the station. Out of those 8 minutes, whatever time they have suggested, you achieve this particular main task and you'll have to finish it within that time. If you don't, then the examiner will tell you to move on, basically. So you have to be aware of that. Okay, now we'll come to marking system. Let me just check. Do you guys have any questions with the scenario?
No.
No, sir.
Okay. Okay, cool. So yeah, now we're talking about the marking system. So there are three things that they will be checking for marking. One is the key steps. This is like a sort of a checkbox thing that is important, that you have to kind of like get, and it's like a to the point sort of thing. Like for example, in a case of suspected chest pain that sounds like ACS, did you get an ECG? Did you request an ECG? So that would be a key step that you should have observed or not observed. That's how they'll mark you, and it'll typically be 2 to 5 amount of key steps in a particular station. Then they will have domains. This also ranges from around 3 to 5 domains, where they judge you on that particular domain on a 7 point scale. Like it will be from 0 to 7. You'll be able to they'll score you based on 0 to 7. And some of these domains include things like approach to the patient, which means whether you are being respectful to the patient. Are you showing empathy? Like for example, if a patient starts to cry, like when you ask, is there any family history of heart attack or whatever, and then they tell you, my father died of heart attack recently, and they start crying, and you just ignore that and you start asking them about their allergy history, yeah, you would be marked down on approach to the patient. So that's a domain that tests you based on how you interact with the patient. Second is history taking. That's pretty self-explanatory, isn't it? History taking, yeah. And then you've got choice and technique of physical examination. This is important for the clinical stations where you'll actually have to do the exam, and also some other stations where you have to request certain examination findings from the examiner. So this like you'll be judged based on this domain in those particular stations. Then you've got accuracy of physical examination. This is more so in a clinical examination situation where you'll actually be able to examine a patient or an actor, and they will expect you to find or list what the positive findings are and some of the important negative findings that you have to rule out in that situation. The next domain is differential diagnosis. This is where you're thinking about all the possible diagnoses that can come up. And then you've got choice or interpretation of investigations. Some of the stations you'll be given an opportunity to tell what investigations would you like further to evaluate a particular case, and this is the domain that actually tests you on those things. Then you've got management, and you've got patient education and counseling. So these are the um, how many domains is that? One, two, three, four, five, six, seven, eight. Around 8 domains that you could be tested on. Out of these 8 domains, you'll have around 3 to 5 in a particular station. Okay, and then finally, this is the main thing. This is the global rating. This is like basically they'll consider all the things that you have done so far. Like, have you been able to meet all the key steps? Have you been scoring high in the particular domains that are being tested in the station? And then finally, they'll give you a global rating based on the above. And this is also a 7 point scale. So from 0 to 7, anything that is below 3 is a fail. And remember, how many stations did you have to pass the exam? That's 9.
9.
You'd have to go through. You have to pass 9 or above stations to pass the exam. It's not that difficult. Passing 9 stations can be done. Okay. Um. Yeah, finish this. And finally, I've got a few tips for you guys. This exam doesn't actually just you don't really need a lot of knowledge for this exam, but you need a lot of practical skills and being able to kind of interact with the patient well, because this is something that we need to like get used to, because it's different. Knowledge is the same whether you're in India, whether you're in Australia, whether you're in UK. It doesn't really change. But the things like the practical skills and the way you speak to the patient, the demeanor, all that changes, and that's something we actually need to learn. That's the main thing you need to focus on. And I'm actually expecting you guys to have the knowledge because you would have passed AMC Part 1 when you're giving AMC Part 2, because that is a must. And then you need to focus on the weak areas that have been identified by AMC1. Like, for example, you're weak on certain pediatrics, for example. You need to like really read about those and try and get more knowledge in that. And please continue working while you're preparing for this exam, because that gives you an opportunity to apply what you are learning. And when you apply what you're learning, you make it a habit. It makes it so much easier for you to go to the exam and literally do what you have been doing throughout the number of years that you have taken to prepare for this exam. Because if you start changing your approach closer to the exam, then you're gonna be in two minds, like, okay, should I ask this, should I ask that? And that kind of like, it doesn't sound natural when someone's actually talking to you and you're thinking so much, you're like inside your own head, you're not actually just being present in the moment and not consulting properly. It actually shows. So it really helps if you're able to just learn this very like at the first step of when you want to give your AMC, and just keep applying it while you're preparing for AMC. And yeah, that's another thing. Learn the approach. There are so many different ways to kind of like go to this exam or do an OSCE generally. Some of the other methods are like, people will teach you about mnemonics, like how do I do this? Socrates for pain, OD para for secretions, and all of those mnemonics. The main flaw with those things are that they force you to think about the mnemonic itself, and you're not being present with the patient, and that comes across as you won't be like you won't be able to react naturally. The thing is, you have to learn to be as natural as possible, and that will only come when you learn the approach, and you when your actual consultation skills with your regular patients changes. That's the only time you'll be able to kind of go through this exam. And if you're able to change your actual patient consultations, then this exam will become a piece of cake. You will literally have to just get up and go to the exam, and you'll be able to pass. Okay. And then be aware of rote learning the cases. Some of the cases, we'll go through a few example cases today, but don't rote learn everything, because then they will change a few things. Like, for example, They'll change a subtle sign or some part of the history. They'll completely change the case. So you need to be able to go through a case like you go through any regular patients that come to you. Okay, so don't by heart the cases. And then you've got, yeah, I told you about the mnemonics already. And yeah, the only way to actually pass this exam to and for your journey in the future to be easy is for you to actually become a better doctor. There's no how do I hack this exam. There's nothing about hacking this exam. You actually just have to become a better doctor, unfortunately or fortunately. All right.